Certainly. While avian influenza primarily affects birds, there have been rare cases of human infections. These instances usually occur when humans have close contact with infected birds or their environments. Here are some key points to consider about these rare cases. 1. Direct contact. Human infections with avian influenza typically occur through direct contact with infected birds, their bodily fluids, or contaminated surfaces. This can happen, for example, in settings like live bird markets or on poultry farms. 2. Transmission challenges. The virus strains that primarily affect birds are adapted to bind to receptors in avian respiratory tracts. For a human to become infected, the virus must undergo genetic changes, allowing it to effectively bind to human cells. This is relatively rare, but not impossible. 3. Severity of human infections. When human infections do occur, they can range from mild respiratory symptoms to severe respiratory distress, and in rare cases, even death. The severity often depends on factors like the specific strain of the virus, the person's age, overall health, and any pre-existing conditions. 4. H5N1 and H7N9 strains. 2 strains of avian influenza that have raised significant concern for potential human infections are H5N1 and H7N9. These strains have been associated with severe cases in humans and have led to fatalities in some instances. 5. Preventive measures. To minimize the risk of human infections, it's crucial to implement strict biosecurity measures in areas where humans and birds interact closely. This includes measures like wearing protective clothing, proper hygiene practices, and regular monitoring of poultry populations. 6. Global health concerns. Due to the potential for genetic mutations and reassortment of viruses, there is ongoing global surveillance and monitoring of avian influenza outbreaks. This helps to detect any changes that might increase the risk of human infections and allows for rapid response measures. It's important to emphasize that the overall risk of human infection with avian influenza remains relatively low, especially with proper precautions and hygiene measures in place. However, vigilance and proactive measures are essential to safeguard public health and prevent potential outbreaks.